Hi, I'm Noga.
Hey, I'm Zach.
Hi, I'm Namkyu.
We're the team at Trace Health. I'm the CEO, general business person, hustler, and do a lot of product work.
I'm the chief technologist.
And I'm UX designer.
So Trace Health came out of this folder right here, which is where I keep my personal medical records. So my personal experience was after being diagnosed with Crohn's disease, realizing, not too long ago that I had spent several years being much more tired and sick than I needed to be because of some simple lack of coordination and communication between my different doctors, essentially not realizing that none of them had run some really basic tests. And so I started looking into the opportunity and recognized that there's actually a huge market, 50 million Americans who suffer from chronic diseases, have doctors in multiple health systems, and do not have any means to personally take control and coordinate their medical information between their doctors.
I also have a personal story with health. I had just graduated from college. I was studying math, and I was working as a software developer, and started also having sort of inflammatory symptoms that were indeterminate, but eventually misdiagnosed. And this misdiagnosis was in large part due to the fact that there's this really sort of erratic manner in which doctors are able to communicate with each other, or in some cases unable to communicate with each other, and don't really have access to your entire health profile. And this is part of my motivation for joining the team. Right now, there's, secondary to the recent healthcare legislation, there's been a big push to digitize and make available electronic health records, but unfortunately, they're all over the place. You're able to access a different healthcare portal for each doctor, and they're separate portals even when they're using the same underlying software system. So what we're trying to do is make tools that enable patients to retrieve, access, understand, and also to share with their future doctors their entire medical histories. And we're even trying to tackle this problem for the many years of legacy paper records that are not being incorporated into these new online patient portals.
I mean, as you hear from Noga and Jag, I think there's so many fragmented healthcare data and very complicated for patient and doctors, and that's why they have miscommunication between a patient and multiple doctors. I think we can make a better user experience with making better data visualizations. So that's our goal for using our design skill.
Yeah. So there you have Trace Health. It's a platform for helping chronic disease patients access, understand, and use their health records to coordinate between their doctors. We think there's a major problem. We're at this unique moment where it's finally possible to pull this data together with a B2C model. And we also happen to be three people with a diverse skill set that we're bringing together to solve that problem. So we're the Trace Health team. Thanks for listening to us.
Thanks.
Thank you.